What if the most dangerous disease growing inside the human body doesn't scream for attention, doesn't cause pain at first, and doesn't even show clear symptoms until it has already changed a person's life forever? Because a brain tumor is exactly that kind of silent intruder. A condition that often grows quietly inside the most important organ of the human body, controlling thoughts, memory, movement, emotions, and even personality. And yet, millions of people around the world ignore its early warning signs simply because they don't understand what a brain tumor truly is, how it forms, and why recognizing it early can mean the difference between life and death. A brain tumor is an abnormal growth of cells inside the brain or the tissues surrounding it, and while the word tumor immediately creates fear, not all brain tumors are cancerous. Because some are benign, meaning non-cancerous, while others are malignant, meaning aggressive and life-threatening. But regardless of whether a tumor is benign or malignant, its location inside the skull makes it extremely dangerous because the brain is enclosed in a rigid bone with very limited space. So even a slow-growing mass can increase pressure, damage healthy brain tissue, and interfere with vital functions. Brain tumors can originate directly in the brain, which are known as primary brain tumors, or they can spread to the brain from other parts of the body like the lungs, breast, skin, or kidneys, which are called secondary or metastatic brain tumors. And surprisingly, metastatic brain tumors are more common than primary ones, especially in adults. The causes of brain tumors are complex and not always clearly understood, but scientists believe a combination of genetic mutations, environmental factors, radiation exposure, and sometimes inherited conditions play a role, because cells in the brain begin to grow uncontrollably when their DNA becomes damaged, causing them to divide faster than normal cells and resist the body's natural cell death mechanisms, leading to the formation of a mass. Exposure to high levels of ionizing radiation, especially during childhood, is one of the strongest known risk factors. While certain genetic disorders like neurofibromatosis, Li-Fraumeni syndrome, and tuberous sclerosis increase the likelihood of developing brain tumors, although for most people diagnosed, there is no single clear cause. Brain tumors are classified into many types based on the kind of cells they originate from, their growth behavior, and how aggressive they are, with gliomas being among the most common types, developing from glial cells that support nerve cells, and within gliomas, there are subtypes like astrocytomas, oligodendrogliomas, and the highly aggressive glioblastoma, which is known for its rapid growth and poor prognosis. Meningiomas arise from the meninges, the protective layers covering the brain and spinal cord, and although many meningiomas are benign, their location can still cause serious symptoms. Pituitary tumors develop in the pituitary gland and often affect hormone production, leading to a wide range of systemic symptoms. Acoustic neuromas affect the nerves responsible for hearing and balance, while medulloblastomas are more common in children and grow rapidly. One of the most frightening aspects of brain tumors is that their symptoms vary greatly depending on size, type, and location, which makes early detection difficult because a tumor pressing on the frontal lobe may cause personality changes, poor judgment, or difficulty concentrating, while one affecting the temporal lobe can cause memory loss, seizures, or speech problems. And a tumor in the cerebellum may lead to balance issues, dizziness, and coordination problems. Early warning signs are often subtle and easily dismissed, such as persistent headaches that are worse in the morning, nausea or vomiting without an obvious cause, blurred or double vision, unexplained fatigue, or gradual changes in mood and behavior. But as the tumor grows, symptoms become more severe, including seizures, weakness on one side of the body, difficulty speaking or understanding language, hearing problems, confusion, and even loss of consciousness. Headaches related to brain tumors are often different from ordinary headaches because they tend to worsen over time, become more frequent, and may be accompanied by vomiting or neurological symptoms. Seizures are another critical red flag. especially if a person with no history of epilepsy suddenly experiences one. Because brain tumors are a leading cause of new onset seizures in adults, children with brain tumors may show different symptoms than adults, including rapid head growth, delayed development, changes in school performance, irritability, and persistent vomiting, which parents and caregivers should never ignore. Diagnosing a brain tumor involves a combination of neurological exams, imaging studies like MRI or CT scans, and sometimes a biopsy to determine the exact type and grade of the tumor, because treatment decisions depend heavily on accurate diagnosis. The grading system describes how aggressive a tumor is, ranging from low-grade tumors that grow slowly to high-grade tumors that spread rapidly and require urgent treatment. Early diagnosis significantly improves outcomes, especially for tumors that can be surgically removed before they damage critical brain areas. But unfortunately, many cases are detected late because people ignore symptoms or attribute them to stress, aging, or common illnesses. Understanding brain tumors is not just about fear, it is about awareness. Because knowledge empowers individuals to seek medical help early, advocate for proper testing, and make informed decisions about treatment. While brain tumors are rare compared to other cancers, their impact is devastating because they affect the core of who we are as human beings, our thoughts, memories, and identities, which is why even a benign tumor can change a life forever. Ongoing research is advancing rapidly, with new imaging techniques, targeted therapies, immunotherapy, and personalized medicine offering hope for better outcomes. But early recognition remains one of the most powerful tools we have. Listening to your body, paying attention to unusual neurological symptoms, and seeking professional evaluation without delay can save lives. Because a brain tumor does not wait. It grows silently, and by the time it announces itself loudly, precious time may already be lost. So spreading awareness about what a brain tumor is, its causes, types, and early warning signs is not just medical education, it is a responsibility. And if this information helped you understand this serious condition better, please support our mission to spread awareness by subscribing to the channel, because every subscription helps us educate more people, save more lives, and fight silent diseases before it's too late.